Hello, I am Dr. Piyush Jain. I am head of the Department of Pediatrics and Neonatology at Cloudnine Hospital, Vashi. Basically, meconium is the intestinal secretion which is there inside the unborn baby's intestine. So, what happens is, even when the baby is not born and still inside the mother's womb, their intestine starts secretions and some epithelial cells, they are already there inside. So this is meconium is already there inside the unborn baby's intestine, and sometimes what happens is if the baby for whatever reason goes into some kind of distress, like if there is lack of oxygen called as hypoxia or asphyxia, and if any other complication of the placenta like abruption of the placenta or cord prolapse, so this causes a sudden deterioration in the baby's condition, and the unborn baby goes into a condition called as a fetal distress. So with the happening of this fetal distress, their intestine starts moving very fast, their anal sphincters open up, and they sometimes pass this meconium even before they get delivered. So this meconium sometimes comes out in the amniotic fluid which is surrounding the baby in the mother's womb, and since we all know that baby is having swallowing motions and sucking motions, so they aspirate this meconium with the amniotic fluid, and this goes to the baby's lung. Once this meconium reaches the baby's lung, this condition is called as meconium aspiration syndrome. So this usually happens in babies who are having some kind of distress in the form of asphyxia, and very rarely if the mother is having some kind of infection also, the babies tend to pass meconium inside the mother's womb. So meconium aspiration syndrome has a very wide spectrum. So the severity varies from very mild kind of disease wherein the baby will have just some mild respiratory distress and some oxygen requirement, and to the other side it can be very serious in the form of severe respiratory distress and breathing trouble, and babies are sometimes unable to breathe, develop pneumonia infection, and may require ventilation. So the spectrum is very wide, and we have to be very watchful. So we should take proper history. We should ask the obstetrician how was the color of the amniotic fluid. If we know yes already it was a meconium stained amniotic fluid and the baby is having distress, then we know yes the baby has aspirated this meconium and has gone into a condition called as meconium aspiration syndrome. And sometimes it is really very serious condition, requires an ICU care, ventilator support, oxygen therapies, and IV antibiotics also.